Around 7,000 years ago, someone cut a hole in another person's skull on purpose with a stone tool. And the patient lived. We know they lived because the bone grew back. This is the oldest surgery we have evidence for, and the part that should disturb you is not the hole. It is how often it worked. The procedure has a name: trepanation. You take a sharp stone and you carefully scrape, drill, or cut a hole through the skull of a living person, down to the membrane around the brain. And then you stop. The whole skill is in stopping at exactly the right depth. Too shallow and you have done nothing. Too deep and you have killed them. Stone Age surgeons with no metal, no anesthetic, and no idea what a brain actually does learned where to stop. We are not talking about one strange skull. We have found hundreds of trepan skulls across Europe, South America, Africa, Asia. Some sites in France, around 6,000 to 7,000 years old, have skull after skull with neat holes in them. This was not an accident or a one-time horror. It was a practice, a technique, something people did, knew how to do, and kept doing for thousands of years. And here is the number that breaks people's brains. In many of these skulls, the bone around the hole has healed, smooth, rounded, regrown. That only happens if the person was alive afterwards, not for minutes, but for months or years. Look at the surviving skulls as a group, and the success rate, depending on the site, lands somewhere far above coin flip. People walked away from Stone Age brain surgery and lived for years. Some skulls even show 2, 3, 4 separate holes, all healed, meaning the same person came back and did it again. They trusted it enough to return. So the obvious question: why? Why would anyone let someone scrape a hole in their skull with a rock? For some of them, it was medical, and it makes a grim kind of sense. A blow to the head, common in a violent hunting world, can cause bleeding and pressure to build inside the skull. The skull does not flex. The pressure has nowhere to go, and it crushes the brain. Drilling a hole releases that pressure. In a world with no other option, a stone tool surgeon opening the skull to let the swelling out is not madness. It is, accidentally, correct. Modern medicine still does a version of this. We just use cleaner tools. For others, the reason was probably about things they could not see. Headaches that would not stop. Seizures. Behavior that changed for no visible cause. To people with no concept of disease, that looked like something was trapped inside the head and needed a way out. So they made one. They were wrong about the cause. But the strange thing is, releasing real pressure would sometimes actually help, which would teach them that the hole worked, which is exactly the kind of feedback loop that turns a guess into a tradition. Now think about what this whole thing requires. It requires the idea that the head is where the problem lives, which is not obvious. It requires a tool precise enough to cut bone, but controlled enough to stop. It requires knowing roughly where on the skull is survivable and where is not. It requires aftercare, keeping the wound clean enough that the patient does not die of infection in a world with no germ theory. And it requires the patient's trust. Someone lay still, awake, while another person opened their skull because the group had done this before and people had lived. That is not superstition with a rock. That is the beginning of medicine, a procedure refined by observation, taught from person to person, with a known technique and a known outcome, performed by people we like to imagine as grunting savages, the same species that we picture barely surviving the winter, was in some valley 7,000 years ago, performing survivable cranial surgery. They could not write. They could not name a single part of the brain. They did not know what blood was for. And they could open a human skull, release the pressure inside, close it up, and hand you back your life, well enough that you would come back and let them do it again. So the next time you hear that ancient people were primitive, remember the skulls with the neat, healed holes. Remember that someone learned exactly where to stop. And remember that they figured it out the only way our species ever figures anything out, by trying, watching who survived, and teaching the next person what worked.